Welcome to the podcast, How to Be Well and Strong. I'm your host, Jacqueline Genova, and I'm excited to have you join me as I speak with some of the leading figures in the fields of wellness, integrative medicine, and mental health as we discover what it truly means to be well and strong in both body and mind. Get ready to be empowered, inspired, and motivated about being an advocate for your own health. Welcome back to the show, everyone. Today I'm speaking with Dr. Derek Guillory about the incredible benefits of hyperbaric oxygen therapy. Dr. Guillory is the founder and medical director of Root Causes Medical Clinic in San Antonio, Texas. He became one of the first certified functional medicine practitioners in Texas in 2015 and has been board certified by the American Board of Emergency Medicine since 2005. Dr. Guillory, welcome to the show. I'm so grateful, as I was just saying, to be able to speak with you. I'm a huge fan of all of the wonderful work that you are doing in the integrative medicine space. And I'm especially excited to be chatting about what I think is one of the most fascinating complementary therapies out there, hyperbaric oxygen.
Thanks for having me. It's a pleasure to be here.
Of course. So, Dr. Guillory, what is hyperbaric oxygen therapy, and can you explain the mechanisms by which it works?
I do like to classify things a little bit broader because I use a lot of different oxygen therapies. So oxygen in general is both a nutrient, right? It's a requirement for our cells to live. We can last about 3 minutes without oxygen. There's a few, high trained athletes maybe a little longer, but we need oxygen to live. But like everything else, oxygen is also a toxin. So every single thing is both a cure and a poison. And what makes the difference is the dose and the context. So oxygen is a medicine that I use. It's a nutrient that I use in a lot of different ways. Hyperbaric oxygen and ozone, we're going to talk about today, are really effective tools for lots of different conditions because of oxygen's unique ability to operate as a nutrient and a signaling molecule. And if used appropriately, that toxicity from oxygen is really, really powerful and not dangerous. So those are some really broad things that are super important to know. But hyperbaric oxygen specifically is getting the tissue concentration of oxygen to the highest possible level. And so there's no other way to get oxygen concentration inside the fascia, inside the brain, inside the muscle and the tendon and the ligament, inside the joints, all of those tissues. It's impossible to get such a high concentration using anything but hyperbaric oxygen. So that we utilize oxygen that way by delivering oxygen at a very high concentration to the tissues that we're trying to treat.
That was very helpful level setting right there. And you just touched on it, but what is the difference between hyperbaric oxygen and ozone therapy? We hear those used interchangeably, but they are not the same thing.
They're not anywhere close to the same. So it's really important. Oxygen exists in three forms. So O1, which is one molecule of oxygen. O2, which is what we generally think of as oxygen, which is the form of oxygen that's in the air and in medical oxygen tanks is O2. It's two molecules of oxygen connected together. And then O3 is ozone, which is three molecules of oxygen connected together. So O2 is very stable. O1 and O3 are both very unstable. O1 is the least stable. Okay, so O3 is a little bit more stable than O1 and a little less stable than O2. The reason we use ozone is because O3 is the best way to deliver a tiny little bit of energized, effective oxygen as a signaling molecule to somewhere in the body. So you can't use O1 because it doesn't exist for longer than micro nanoseconds. Ozone exists as a molecule, as a signaling molecule for a little while longer, so I can use it effectively. But it's like putting energy into this is how I explain it anyway. It's like putting energy into the oxygen molecule. So everybody has heard of oxidative stress, right? And in general, people want to get rid of or remove oxidative stress. But ozone holds its power because you can use a tiny little bit of oxygen as a damage signal that doesn't deliver any damage when it's used appropriately and thoughtfully, but it delivers the signal that free oxygen is there causing damage, and that turns on healing. So when I put oxygen ozone mixtures into a knee for somebody who has degenerative arthritis, that does not damage the knee, but it sends a signal to the knee and all of the stem cells, the chondrocytes, the bone cells in the knee, that they need to repair that tissue because of the unique nature of powerful oxygen as a damage signal.
That's fascinating. And that leads to my next question for you is I know there's several different methods by which you could administer ozone therapy, right? We've heard of intravenous ozone, injections. I think I saw you do one on Steph on your Instagram a while back. But what, I guess, are the most effective ways of administering ozone? And does one way have a benefit over another? We've heard of rectal ozone. How does one choose the right one?
So it's a great question. I use all of them. Systemic ozone treatments can be delivered through the skin, in the blood, and rectal ozone. So what that's doing is sending a signal sort of to the whole body that elevates our body's natural healing capabilities. One of one of the primary ways it does that is it increases detoxification and repair enzymes and mechanisms in our liver and in our other tissues. And so when we have a ozone sauna, it's commonly called the Hocket sauna. There are other ozone saunas out there that delivers ozone to moist skin, and those little ozone molecules quickly react with our skin, the proteins and fats in our skin, and that sends a systemic signal, heal. So it ramps up these enzymes in our liver and in our blood that turn on healing. The same thing happens when we do it rectally. So when you put ozone into the rectum, those tissues are really absorptive, and that goes directly to the liver because of the circulation in the colon to the liver. And so that turns on detoxification in the liver. It turns on healing repair mechanisms. Of course, the way we do it most commonly here is in the blood. So you can deliver a little bit of oxygen to the blood, or you can deliver a lot of oxygen to the blood. And there are different machines that we use to deliver that signal. And it's picked based on what the patient is suffering with, and also their general level of vitality. So if someone's really sick with a chronic illness, they can't tolerate as much ozone concentration or as much of a dose. And so we have to tailor that to the patient. But those are the three ways we do systemic signals of ozone. I will inject, like I actually just got finished injecting my mom. She has chronic degenerative arthritis and pain. So we inject directly into the tissues, the soft tissues. So joints, muscles, fascia, around tendons. I have injected just about anywhere you can put a needle, you can put oxygen. And that signal turns on healing repair mechanisms in those tissues directly.
What you were just saying brought me back. I mean, my first experience with ozone therapy was actually back in high school when my dog was diagnosed with cancer. And her diagnosis was really one of the first catalysts that piqued my interest in the alternative medicine space. And I found a holistic vet, didn't even know that was a thing at the time, who practiced ozone therapy. And I recall holding her while he administered it rectally and just felt her body expand. It was the strangest sensation. But only now looking back do I recognize what was happening, and it did play a big impact in extending her life.
Yeah. And it's doing much more than that. I mean, I can talk about ozone by itself for at least an hour, all the different ways that ozone works. And I use it in many ways for many different patients with multiple conditions. Um, so it is a very natural, very safe. I mean, the thing that people don't understand is there are 3,000, there's probably now almost 4,000 published papers on ozone and its medical utility, mostly out of Europe, but
Yep.
very safe and very effective. And I personally have had a lot of benefit from ozone. And, my initial patients were my family members. So my brother, my kids, my mom.
Not surprised. That's wonderful. And to the Europe point, I feel like they're ahead of us in so many areas, right? Like they've been using mistletoe for quite a while, and now it's only starting to come to the States.
That's right.
Um, that's great, though. And you mentioned in a conversation we had a while back that disease has two causes, right? Deficiency and toxicity. And we know that cancer itself seems to create a deficiency or areas of low oxygen in the body. And I've also read that cancer cells have been shown to become more aggressive as they adapt to lower levels of oxygen. So it would make sense then that hyperbaric oxygen or ozone therapy would be an effective treatment. But I've also seen some conflicting studies done, like in vitro and cell lines in animals, that have expressed concern over it potentially making the tumors worse. What are your thoughts on that?
It's a great question. So, real importantly, with medical research, um, almost all of these studies fail on a major point, which is that they are not looking at a complex, special, unique individual. They're looking at a treatment modality. So I always say I don't treat cancer, I treat people. And people are, you can manipulate lots of variables in a complex person. So all these studies are conflicting because they're looking at the variable, not the person, and you can control variables in people. So, tumors in general like to create an area of low oxygen. They like it when there's low oxygen there. That's not always true, but it's generally true. And their oxygen is working on multiple levels, right? So if I had a person with a tumor that was driven by oxygen or by blood flow, I would hesitate to give them oxygen. I would change some of those variables. I would want to try to fix the blood flow issues before, and some of the other metabolic issues before I would give them oxygen. So the conflicting results are a big problem with lots of treatments. But the real important thing is look at the person, not the disease. And in a person, I can do all sorts of things. And when we make that environment favorable for oxygen treatment, it's helpful.
Couldn't agree more. And in a patient with active cancer, hyperbaric or let's say like intravenous ozone, which would you choose?
Well, thankfully, I don't have to choose. I generally will do both. Yeah, so remember, there are two different ways to deliver oxygen. There are two different, not just two, many different things that we're doing with ozone. So, one of the reasons we use ozone in cancer patients is because the immune system is a primary driver in all cancer patients. In my experience, the only way to get stability or remission long term from cancer is to get immune recognition of the tumor. And when you get immune recognition of the tumor, that immune system can continue to fight back on the tumor cells. So, one of the things that ozone is doing is helping to attain immune system recognition of the tumor cells. And so, ozone is a tiny little signal. We can use not very much of it in different ways in different places. Hyperbaric oxygen is both an oxidative treatment, which is putting pressure on the tumor cells that don't have a capacity to deal with oxygen as a toxin, and it's also affecting the metabolism because um, tumor cells don't like oxidative metabolism. They like to use anaerobic metabolism, right? So when you use oxygen and hyperbaric oxygen, we're doing it on those two pathways, And ozone is a little bit of an immune system pathway. Now you can use ozone the other way, but that depends on the location of the tumor, if it's accessible with a needle and things like that.
Interesting. Are there any alternative or complementary therapies that can be used alongside ozone or in fact or hyperbaric or that should be paired with it? I recall you mentioning somewhere that you should combine a metabolic as well as an immune therapy with it.
Yeah, I like to, with cancer patients specifically, so I always have two priorities: symptoms and causes. So this is true for every patient, but specifically with cancer patients, we have to remember that tumors are symptoms, and you have to do something about the tumor. Um, and then when you get tumor stability or tumor regression or a tumor gone, then the primary focus is causes. So ozone and oxygen therapy are actually treating both potentially. So I love to use therapies that are affecting multiple pathways in both normal physiology and in cancer. So I'll combine real commonly oxidative therapies, metabolic therapies, and immune therapies to try to put pressure on tumor cells, right? Because I want to make them really uncomfortable. And then on causes, those are also affecting causes. So the immune, the metabolism, and the oxidative stress pathways, those are also working on causes. So combination therapies, in my experience, work much better, and they're very well tolerated with low side effects. So much better than a very very toxic agent that's just working on one pathway, and you have to use a lot of it at a high dose. I find that when you combine therapies, we get better results.
Has there been any literature on the use of ozone in patients who choose to pursue conventional treatment routes like chemo, for example? I mean, we've seen literature on like high dose IVC with chemo, and they kind of could work synergistically or at least help mitigate the toxicity.
Right.
But is there anything with ozone?
There are, so it depends on what you mean by data. So there are no randomized controlled trials. There are case reports and there's clinical experience, which is valuable, very valuable. But it's very difficult to track some of these treatments because we're not treating cancer as a disease, we're treating people who have cancer.
Mhm.
So the comprehensive approach is very difficult to track from a data standpoint.
Is there a certain amount of treatments on average that have been shown to be most beneficial based on your experience?
I mean, people really have to understand that we're all stuck in a trap. And the trap is, what's the name of my condition and what's the cure for my condition?
Yeah, Dr. Guillory, I just want to pause there because again, we had a conversation a while back for an hour and I just was taking notes the entire time because I love your philosophy on this. And if you could just go ahead and share that with the world on your take on disease and what is, I guess, the proper view of it.
Yeah, so this is just a systemic problem because we're all trapped in the acute care medical model, which only asks the question, what is the name of my condition? What is my diagnosis? And if I get a diagnosis, I look at a chart and I see what's the cure for my condition, right? But that's a trap because there is no cure for a complex chronic illness. The causes are multiple. There's always genetic predisposition. There's always environmental triggers. There's always multiple things. There's at least two. I mean, this is why I have an S in my name. It's root causes medicine, because there's always two factors at play, at least, generally more. And so, how many treatments it's a great question. I see patients get improvement sometimes after 3 weeks of treatment, sometimes dramatic improvements. But cancer specifically, and other conditions too, will, in my experience, always recur until people understand this is a journey. I've been on a journey for 20 plus years in my healthcare journey, personally. And it's working out the causes of disease all the time. And that's the solution. So for cancer patients, we want to quickly get control of the tumors. We want to control the symptoms, right? Slow their growth, stabilize their growth, get them to regress. Hopefully, with lots of prayer and good work, the tumors can go away. And then we work on causes, on all those drivers. Cancer, you have to ask the question, why did the cancer cells show up? Well, it's because of my metabolism. It's because of my immune system. It's because of my environmental toxicity. All those things can be put under those two broad categories of deficiency and toxicity. What do I need that I don't have? And what do I have that needs to be removed? And we just make lists of things we can do over time. And that's winning the game, which is the process. It's the journey that we're on.
I love that. No, I couldn't agree more. And I think too, I forget if Evilise or someone else had mentioned this, but they described conventional cancer care as like playing whack-a-mole, right? Like you see something come up, you hit it with radiation or target it with chemo, but again, you're not addressing the root cause or the internal terrain. And at some point, 1 or 2 years later, it's going to come back and it's going to come back even more
Right.
aggressive. And I think the irony too is that they're creating all these pharmaceuticals, right, that target different mutations of the tumor, but you ask yourself, why are these mutations
Yeah.
occurring? And most of the situations, it's from the radiation or it's because it developed a resistance to the hormone therapies that patients are on for years. So it's such a different approach. And I'm so glad again that you are educating people on this and, for all the work that you're doing in this space because it is very needed.
Appreciate that.
And with that too, I mean, sadly, there's not enough clinics that have these therapies available for patients, right? Because they're not approved. So, for patients who don't have access to a hyperbaric chamber, what are some options that they have? And I myself have contacted like quite a few centers, even hospitals in New Jersey, asking if my mom could go and receive hyperbaric treatment. And they've basically said no, it's limited to burn patients, which I'm not surprised to hear. But I've also seen people purchase ozone machines, then again, like self administer it themselves. So, what are your thoughts on that?
Well, so it is a dilemma. The first step would be to see somebody that can help patients understand whether the treatment is going to be effective for them, and then how to deliver it. So, ozone can be delivered at home rectally with a home ozone machine. There's some very specific things that you have to understand. It's really safe, a very safe treatment, but you have to know some things before. So the concentration is really important, the quality of the machine, and using medical oxygen, in my opinion, rather than room air to create the ozone. Hyperbaric oxygen chambers as well. You want to talk to somebody who knows what they're doing, because for all my cancer patients, for instance, I don't like them to do hyperbaric oxygen treatment unless they're in therapeutic ketosis. So their ketone levels need to be above 3. That's a serum blood ketone level. And then we have to make sure that they have the capacity to deal with that oxidative load. And so that's a combination of nutrition and sometimes supplementation. For instance, melatonin, I put most of my patients on radiation and doing hyperbaric oxygen on some melatonin, not to help them sleep, but because it's a powerful antioxidant that is in every single one of our cells in the mitochondria. And so, those are just two factors for patients. But you can buy a hyperbaric oxygen chamber. You can use it at home. Those are low pressure chambers that do have some benefit, primarily for athletes in regenerative medicine. Um, the question of whether they're helpful in cancer patients is unclear. So the low pressures and the low oxygen tension. So it's tough. You know, Hospital centers are bound by these contracts with insurance providers and government payers. And so they're not allowed to see these patients that don't have an approved indication for hyperbaric oxygen. So you have to go somewhere that has a chamber that knows how to use it and that will, use it right for your particular condition.
Yeah, well, hopefully one day we'll be able to change that if we continue to do the work that we're
That's
doing. Your comment on ketosis triggered another question of mine. we've seen literature on the benefits of fasting, right, prior to both conventional treatments like chemo as well as complementary modalities like IV vitamin
Right.
C. Does fasting before ozone, for example, increase efficacy? Has there been any, I guess, insight or research into that?
I find that it is more effective. There's no good research on it, but I do find that I get better results in patients who have fasted. So there are a number of
Interesting.
reasons why that might be true. Um, it does have something to do with ketones, and also, our bodies are just a fantastic miracle. Like every single thing is a miracle when you think about it, right? And so there's all these things that we haven't worked out yet that are benefits to fasting, and our cells are listening to that signal. He hasn't eaten in a while. What's this about? And then you add oxygen, which is a really powerful signal, like, holy smokes, he hasn't eaten and he's getting exposed to free oxygen. That makes sense to really turn on repair mechanisms. So I do a bunch of this stuff. I love to use temperature. I do extreme cryotherapy and extreme sauna therapy because those hormetic signals, it's sort of like damage signals, really help to, I believe, promote youthfulness, longevity, recovery, regeneration. I mean, we haven't even talked about the potential ability of ozone and oxygen to stimulate our own stem cells, which is true. These are published papers, and stem cells are these magical cells, right? So all these things are aimed at healing. Help me to heal. That's a long-winded answer to your question. I love fasting in combination with any medical treatment.
Everything you're saying, I'm just nodding in agreement for folks who can't see. I'm a huge fan of hermetic stressors. I just got a sauna blanket. So I live in an apartment. So I'm kind of limited with space, but I will go in that sauna blanket every single morning, followed by a cold shower. I'm trying to convince my mom to do the same, but cold showers are
Yeah.
not her thing. So we're slowly dipping her toes into the water there. But in addition to cancer, which again, I could spend hours talking to you about, I've heard that hyperbaric oxygen has also been shown to increase healing in the brain after traumatic brain injuries, as well as slowing the progression of neurodegenerative diseases like dementia. What other specific conditions or diseases can hyperbaric oxygen help with?
So I have used hyperbaric oxygen for lots of different conditions. Again, the importance, it's a subtle difference in conversation, but I don't treat conditions. I treat people. And so I have used it for people with neurodegenerative disease like Parkinson's, Alzheimer's, and other forms of dementia, traumatic brain injury, and stroke. There's some data in all of these conditions that shows that it can be beneficial. I've used it in neurodevelopmental and neuropsychiatric cases like autism spectrum disorders and others. Um, Athletic injuries, major improvement for a lot of these injuries. Autoimmune conditions, chronic infections. I mean, so the reason for that is because oxygen is a nutrient and a signaling molecule, and when used appropriately, it sends very powerful signals.
Fascinating. Are you familiar with the superhuman protocol
Yeah,
by any
yeah,
chance? So, for listeners, it's this protocol that essentially uses, I think it's PEMF therapy, oxygen training, and light therapy to essentially promote what they say is like the highest level of
yeah.
physical and mental conditioning possible. The second part of that protocol is exercise with oxygen training. So, what are your thoughts on that for an otherwise healthy individual? Is it something that people should be proactively incorporating into their wellness
I mean,
routines?
I do a version of that that I've sort of developed myself here in my office. So the answer is yes. I love to play with both temperature, so cold and hot, and oxygen and activity at different concentrations. So the best, in my opinion, version of oxygen therapy for highly trained athletes is, uh, you know, we can simulate a person training at a normal sea level. So you've heard of athletes training, right? They go up to high altitudes and they train.
Yes.
Okay, so exercise with oxygen therapy is the opposite of that. So you provide lots of oxygen so your muscles can do more work. Okay. Well, if you train at altitude, your body sees that signal as, man, there's less oxygen around. I need to create a better availability of oxygen using tissues, right? So the best method is to rapidly switch those. So we can put somebody at 100% oxygen and then immediately flip them to the top of Mount Everest, and then go right back to 100% oxygen. And so what that does is it turns on these little healing mechanisms that's like, man, I need to increase my ability to do this work because the oxygen tension is changing. That's a real simplified analogy, but yeah, I love those types of therapy and I use them myself.
I love that. See, if I was closer to your clinic, I would have come in this afternoon to do a session. Even too, I mean, I've had so many concussions in the past, and again, had I known about the benefits of hyperbaric oxygen for it, I would have been, right in there after that injury. But Dr. Guillory, this has been incredible. I want to be cognizant of your time. Again, I could spend hours chatting with you, but we touched on a lot, so I'm very excited to share this with listeners. Where can listeners find you?
Right now, so my clinic website is rootcauses.com. And then I do have my personal blog site, which has not been active for lots of reasons, but it's going to be coming live soon, which is drguillory.com, just spelled out.
Wonderful. And I'll include those in the show notes. My last question for you, Dr. Guillory, is what does being well and strong mean to you?
Wow, that's a great question. I would say, like for all of my patients, I see patients. My youngest patient, I think right now, is 18 months old. My oldest patient is 93, and
wow.
And everybody in between, right? And so everybody is on a different step on this journey, which can be really long or really short. So I think well and strong means having the best possible quality of life today, because I can't do anything about yesterday and I can't predict the future. So it's today. What is my life like today? What do I want it to look like today? And having the energy, the mental clarity, having the ability to function as best I can today is a really, really powerful thing. Living in the moment, but being able to enjoy it.
I love that.
So I try to get that thought across to many of my stage 4 cancer patients. And the amazing thing is that's where the magic happens. When people are living for today and enjoying the moment, they love better, they listen better, and they feel better. And sometimes we get remission.
So true. Yeah. Those are my favorite cases. And again, Kelly Turner's radical remission, that was one of the commonalities, right? People who lived in the present, experienced forgiveness. And again, our cells listen to our thoughts. So I think that is critical, 100%. Yeah. Wonderful. Well, Dr. Guillory, thank you so much. And I can't wait to have you on again.
Thank you so much. I enjoyed it. I appreciate you.
I hope you enjoyed this episode. If you would like to support the show, please subscribe, leave a rating, and share it with others. Be sure to visit WellnStrong.com to access notes from the show and to stay current with new content. I'm so grateful you joined me. Be well and be strong.